Hi, my name is Faysal Yafi. I'm a urologist at the University of California, Irvine, and I'm the Director of Men's Health at the University of California, Irvine. My interest in IPP surgery comes from seeing patients who've had prostate cancer surgery and who were impotent afterwards and didn't have any options. They were failing pills and injections. So I thought, how can we help these men recover their lifestyle and have a better quality of life for them and their partners? I think IPP surgery is really important. It gives people hope. It allows people to regain something that is missing in their lives. It allows couples to be able to connect again. Sex is important, but I also think it's a surgery that can be easy, but also it's really important to have experience and to be well trained with it to offer the patients the best outcomes possible. I think the general awareness about the procedure still remains very low. There are patients who are informed about the surgery, but for the most part, patients will suffer for many years. If you look at the data, patients wait very long from the time they have ED that is not responsive to pills or injections before they finally find someone or learn about penile implants. So I think a lot needs to be done to increase awareness about this surgery that can be life-changing. So even though we're busy and our practices keep us busy and we have to help our patients in our community, traveling to conferences, traveling to all around the world allows us to learn from other surgeons, learn new techniques, but also teach others all around the world what we know so that we can not only help people in our community, but people all around the world. Being here today in Seoul with Professor Sean Park, who has probably the most experience in Asia with implants, allows me to learn from him and bring things back. On my last visit in Korea many years ago, I learned from him a technique that we continue to use in our implants today. And today, just watching him do surgery, I learned a new technique that I'll take back with me home. Continuous medical education is at the forefront of medicine. You don't want to go to a doctor who's been doing the same thing for the past 20, 30 years because we evolve. My mentor says that if in 5 years we're still doing the same thing that we were doing 5 years ago, then we're failing. 5 years later from now, if I should look at what I was doing before and think, oh wow, that's crazy. There's so much better ways of doing it. Continuous medical education allows us to learn new things. And allow us to improve what we can offer patients and to decrease their suffering. When you train fellows, you have to think, how can you make them the best that they can be? And that can be clinically, and that can be with research, and that definitely can be with surgery. So my rules are, you have to dedicate the time, you have to become a mentor for life, and you have to keep that connection with them so that as they are growing in their practice and learning when they first start, you're available to help guide them through difficult issues and complications. And that's what I had with my mentors in the past, and it's what I tried to instill into my fellows in the future as well. Yeah, today's surgery is wonderful. Whenever you watch a master doing any kind of surgery, it's always enlightening. Every time I watch Dr. Park operating, I learn something new. Last time I came here, I watched him do pudendal blocks. Today I saw him do an epidural block for a revision case, and the patient was chatting with us throughout the entire surgery while Dr. Park was doing a pretty complex surgery. So I think every time I come here, I learn something, and he is definitely a master in his trade. Dr. Park is a visionary. So, Dr. Park trained and came here the hard way, and I can correlate with him because I came up the hard way as well. But he was able to build one of the busiest prosthetic practices in the world, definitely the busiest prosthetic practice in Asia, out of nothing. And now he has this wonderful clinic, and he's offering state-of-the-art surgery. And what he is able to serve the people of Korea and the region as a whole outside of Korea is truly inspiring. And I think every young surgeon, especially outside the US, who's trying to build a prosthetic practice needs to come and visit Dr. Park. It's easy to find excuses, but there's always a way you can do it, and he's a good example of someone who's made it the hard way, but who's been incredibly successful and just a wonderful practice. It's a beautiful location, and the care here is exceptional. So my practice continues to be heavy on prosthetics. As I've started now a second fellowship, besides a reconstructive fellowship, we have a men's health fellowship. My goal is to train even more people who are going to go outside in the community in various places in the U.S. and the world. Our fellows are international, so that they can continue, offering these services to patients in need. And the goal is to continue doing research. We have a lot of research activities going on, particularly with regards to prosthetics, is the PUMP database, which is the largest penile implant database in the world, of which Dr. Park is a member, and to continue doing research so we can kind of find out what are the things that we can improve on and what are the things that we're doing that are not right, that can be done better. So we have to continue evolving. My goal is to become busier and busier and evolve as a surgeon to discover new techniques and improve on the techniques that we already use. So the Barbara and Steve Wilson Foundation is something that's very dear to my heart, as it is dear to Dr. Park's heart. Dr. Wilson is the pillar of sexual medicine. He's trained more people than anybody else in history. He's done more implants than anybody else in history, and he and his wife have been very generous in starting this foundation to continue the education of prosthetics. Our goal is to make prosthetics more worldwide, allow more people from all around the world to get the same access that some of us who are more privileged in the US get, and to allow people who are starting their training to get experiences such as visiting Dr. Park in Korea, which is going to be one of the pillars of the foundation, where they can come in for a week to 2 weeks every year to learn from an expert so that they can take these skills back and be better surgeons in the US or anywhere else in the world for that matter. So as Secretary of SMSNA, my role is to continue the education and the training and the legacy of SMSNA in the US. I think the Sexual Medicine Society of North America is a very strong society that is led by some incredible people now, and has been led by incredible people in the past, and I'm sure will continue in the future. We just have to continue that momentum and make sure that the new generation continues to be interested in sexual medicine and continues to learn what's newest and best, and find out what the newest developments are going to be in the future, so we can offer our patients the best options.